finished your cleaning. So your next appointment is going to be for a crown. You can plan about 2 hours for that appointment. And before I send you off, do you have any questions?
Yeah. So what is a crown exactly?
That is a great question. A crown is a protective covering for a tooth that's been broken down. But I think a picture will help you. Let me show you this picture. It gives a little better idea of what a crown actually is. So here you see a tooth that has been broken down, either by some sort of fracture or trauma, or in your case, some cavities. And when a tooth has become so broken down that we can't put a normal filling in it, we place this protective cap on top of it, and that helps us to maintain your tooth so you can keep it.
So I see that tooth looks like that, but my tooth is broken.
That's another good question. This is what we like the tooth to look at right before we put the crown on, but like you said in your case, your tooth has had some cavities and it's a little broken down. And so in your case, what we're going to have to do is something we call a buildup. So let me show you a picture of that. So you can see here, we have the tooth and then we kind of have this gray material. And if you can imagine where this gray material would be taken out, it's almost as if the tooth is broken down. And so when a tooth is really broken down, we still need to give some surface area and strength for the crown to sit on. So in your case, what we'll do is we'll clean up all the cavities and we'll make sure we have a nice, smooth outer rim. And then we're going to fill in the defect, that broken down part of your tooth, with what we call buildup material. And I know you have been concerned about the color. The buildup material won't shine through. It'll be completely covered up by the crown.
So the buildup is kind of like a filling?
It's kind of like a really big filling. So if you can imagine, we just drilled a little bit in the top and we put some filling material in. Instead of just filling one little spot on the tooth, we're filling the whole broken down part of your tooth.
So am I gonna go home with my tooth looking like that? Or am I gonna go home with the crown?
That's a really good question. So let me tell you how the appointment will work. You'll come in like you do for a normal filling. We'll get you numb, and from there, we'll make sure that we get the tooth looking pretty much like this. We'll get all the cavities out, and then we'll put the buildup material in, and your tooth will look something like this. And at this point, we're going to take an impression so that the lab knows the design that the crown needs to be made to. But we don't want to send you home with a tooth that looks like this. We're going to make what we call a temporary crown, which is a replica of your tooth that will sit on top of the buildup, but it won't be as strong and it won't last as long as a normal crown, and that's okay. It's only going to last 1 to 2 weeks until the actual crown is made by the lab. At that point, we'll have you come back in, we'll take off the temporary crown, and we'll put your really strong, brand new crown that matches your teeth onto the buildup. In general, we want you to avoid as best as you can chewing on the temporary tooth. If you have soft foods or liquids, you're fine to chew or to put the liquids over on that side of the mouth. The thing we really want you to avoid is really hard and crunchy foods and sticky foods. Hard foods can crack it, and sticky foods obviously can make it a little bit loose, and you run the risk of actually having the temporary fall off. Another thing that I should mention is it's very important to keep the temporary crown clean. If we don't keep it clean, what can happen is your gums can actually get a little bit inflamed, which means they'll swell up and get bigger. And it can actually make it hard for us to put the actual crown on when it gets here. So in order to do that, we want you to floss a little bit differently than you would with your normal teeth. So let me demonstrate right here on this typodont how to do that. Where normally you're going to put the floss in and pull it right back out, I want you to put it in and then pull it through. And then put it in on the other side of the temporary crown and pull it through.
Oh, that shouldn't be a problem. I never floss anyways.
I know flossing can be a challenge, and I know we've talked about it before. But you're investing a lot of time and financial resources into this crown. How motivated are you to keep this crown?
Oh, I want to keep it for as long as possible.
That's great. We have the same goal. I'm really going to encourage you to start flossing so we can keep this crown in your mouth for as long as possible.
Yeah, I think I should start flossing. Thank you.
before we leave, is there any other questions that you have about the next appointment or about how long your crown is going to last? Anything?
No, I think I'm good. Thank you so much.
Great. Well, thank you for coming in today, and we look forward to seeing you at your next appointment.